My son Bo was diagnosed with skin tuberculosis when he was 8 years old.
I have this disease. I don't know really I get it, but I had my symptoms last Christmas.
En realidad,
At first, nobody knew what was wrong with him.
fue un transcurso de proceso en el doctor.
We saw many doctors, and it was a long, long process in trying to diagnose him.
At first, you know, it's the shock, it's the scare, it's the, oh my gosh, he's got TB, he's so immune compromised, he's never going to be able to overcome this. He's going to die from this.
I don't like this kind of disease. This is not my fault. I'm sad about it. And a little bit depressed.
En el cerebro, para mí fue como...
The first thing that came to my mind is that we're all infected. I have children at home, and I thought that they were all infected too. It was a tremendous impact on all of us.
I didn't think there was such a thing as extrapulmonary TB. I thought it was a pulmonary disease and that's it. Once he tested positive, we were all educated about extrapulmonary TB and how it can attack all the other areas, all the other organs you have, anywhere in your body.
And you see blood in your sputum, it's scary. And not only scary, it's depressing too, because it's just unknown to yourself how far it will go.
Como tuberculosis.
Before I came to the health department, my concept of TB was that only people living in remote areas or in dirty places would get TB. I never imagined that in this country there was such a disease as TB. I thought to myself, my husband with TB, I thought this disease was only on farms or ranches, like something dirty, and I learned otherwise. I learned that anyone can get TB.
We were met by the TB clinic at our home. We had all our other family members there. They educated us there on how Bo has a unique form of tuberculosis being in his skin, and it's not airborne.
The medical staff are caring, professional, and respectful.
Our caseworker, Sheila, does very well with the pediatric community. We were actually put at ease by a pulmonologist that she works with, and he said, don't worry, Sheila's on your case, you're going to be just fine. And you know, he was right. She's been, you know, a blessing to our family through this past 5 years.
We felt that we were going to infect everybody, but the nurses at the health department taught us that TB of the brain is not contagious. And day by day, week after week, they have shown us patience and compassion.
The treatment course consists of 9 tablets, and the duration is up to 9 months.
He's taking a special treatment for TB, which consists of 11 pills every day. He's tolerating this medication very well, even though there are a lot of pills.
We've been dealing with it, though, for 5 years. He's been battling through it. He wakes up and smiles every day. This is just something that happens. You know, it was airborne. He happened to breathe in that air. It bypassed his lungs. It went to his next weakest organ, which was his skin. I think the message that, you know, the TB clinic hands out about educating, I think, is huge. It's extremely important. You know, cover your cough, wash your hands, do things such as that, because it really does help prevent the cause of this disease.
This kind of diseases, again, it's not your fault. You acquire them from others. Whoever you are, whatever you do, sometimes TB bacteria might catch up on you.
My neighbors ask me frequently, what's wrong with your husband? Some of them would hear the word TB and they would kind of back away and say, oh my God, TB.
I think the stigma of TB is terrible because it doesn't happen to dirty, unclean people. It happens to normal, everyday Joes. It happened to my almost pristinely kept special needs child who doesn't interact with the community, and it got him just one day. It got him.
When you have this kind of disease, always follow the instruction given by the medical professionals. Like for example, wear your mask. And then when you cough, cover your mouth. And be sure to avoid crowded places, because you never know you might spread the disease.
I now have hope that he's going to be okay, and he's going to be a testimony of what God has done in his life and in ours.
He's changed us. I mean, the disease changed us also, but having him and having someone who's just so pure and so innocent and so just, he loves no matter what. And we learned that through him. He's just the greatest little thing ever.